Hey everybody, it's Paul Barrett from the Modern Medicare Agency. Today I want to help individuals that are getting ready for Medicare to basically start to understand the basics, A and B, right? Original Medicare A and B. I think it's hard to choose a plan when you don't really understand what A and B does, how much it's going to cover, how much it's going to cost, etc. So we're going to make some short videos for you, hopefully that we can keep your attention span and not bore you to death, right? We don't want to make anyone fall asleep. So let's talk about Medicare Part A. That's the first part. Medicare Part A of Original Medicare is inpatient coverage. Inpatient could be inpatient hospital, of course. It could be inpatient psychiatric ward. It could be skilled nursing facility. It could also be hospice care. And sometimes it's even in-home health care. Now, Part A usually is going to be free for most of us, okay? So that comes from working at least 10 years or 40 quarters and paying your taxes, okay? So if you've worked 10 years, 40 quarters, and you've paid taxes, you're going to get Medicare Part A for free. If you haven't, but you're married to somebody that did that, you're also going to qualify for Part A for free. If you didn't do that and you want to know how much it's going to cost, then just give us a call at the office and we'll go over all that with you. 631-358-5793. Now, getting back to Part A, Part A has a deductible. It's $1,600 here in 2023. Now, the deductible is unlike most deductibles that we're used to because it's a per incident or per occurrence, which means if you go into the hospital in January, you have a heart attack, God forbid, and you're in there for 10 days, you pay $1,600. You have an accident in June, falling off the roof, cleaning the gutters and getting the leaves out, and you break your hip. When you go back in, you're gonna pay $1,600 again, all right? Unlike our auto deductibles, which are typically annual, this is per occurrence, okay? So this is one of the reasons why folks always ask, why do I need a Medicare Advantage plan? Why do I need a Medicare Supplement plan? Well, the Original Medicare really can leave you paying a lot of money out of pocket. But for Part A purposes, we're just talking about the $1,600. After that, you need to know, when you look in your Medicare New Guide, they show this chart of what happens if you're in the hospital over 60 days, because that $1,600 covers day 1 through 60. If you're in there day 61 through 90, then you're gonna be paying $400 per day for each day you're in the hospital. If you're in the hospital past that, you're gonna go into what's called your reserve days. You get 60 of them. Lifetime reserve days. So if you're in the hospital past 90 days, days 91, okay, moving on to 150, you're going to be paying $800. $800 per day, okay? And anything past that, you're going to be 100% responsible. Now, of course, I've been doing this for 17 years. I've never seen anybody have that happen. Maybe if you're in a coma, it could happen. It's the least of our worries. So once again, recap, Part A, it's going to be free for most of us as long as we've worked and paid taxes. Keep in mind, you have to have paid taxes. I know a lot of people, cash jobs and things like that, they don't realize what's going to happen when they get ready for Medicare and Social Security. If you didn't pay your taxes, Social Security check's small, and you may have to pay for Part A. But for most of us, it's going to be free, whether you get it through yourself or a spouse. Okay, in 2023, $1,600 deductible. It's not annual, it's per occurrence. All right, now we mentioned that hospital stay. That's how it works for both inpatient hospital and inpatient psychiatric. If you end up in a skilled nursing facility, Medicare is going to cover the first 20 days, 100%. You pay zero. After that, you're going to be responsible for days 21 through 100. You can pay $200 a day. Anything over 100 days, once again, you're probably not in there. Skilled nursing facilities realize they're not going to get paid. They want to get you out as quick as possible. But if you do have to go over 100 days in a skilled nursing facility, then you're going to be 100% responsible for the cost, okay? That's Part A in a nutshell. So if you have questions about Medicare Part A, Medicare Part B, or just want to chat because you're getting ready to turn 65, all you have to do is give us a call at 631-358-5793, or you can email us at medicare@paulbinsurance.com. Thanks so much for watching. I hope you learned something.